This series of videos demonstrates how a direct service provider should prepare and pass medications. We will emphasize our 3 checks and the 6 rights of medication passing. When time for your medication skills demonstration, direct service providers will be checked on their ability to safely pass medications in this manner. The first thing that we will need to do is review the MAR. The particular MAR we will be reviewing is for Sunshine Group Home with our pretend client, Jack Armstrong. His date of birth is April 23rd of 1956, and we're going to look at the allergies, which will be at red at the top. This particular individual has known allergies. We're going to familiarize ourselves with any medication that we have to pass during our shift. Again, this is 8:30 in the morning, so we're looking at Depakote, 250 milligrams, Prolixin Elixir, externally Caladril lotion, and bacitracin ointment, cortisporin ear drops, gantracin eye drops, and then we will also be requiring you to know how to do a preparation H suppository for your med demonstration. We will discuss that later in these videos. Now that I've reviewed the MAR, I need to know direct information about the medications, including the desired effect, adverse effects, and any contraindications, including the allergies that the consumer may have to the medications that we're passing. If you're unfamiliar with any medication that you were scheduled to administer on your shift, you're going to check with a current medication resource such as a drug handbook, a smartphone app, calling the pharmacist, looking at any pharmacy printed information that came with the medications, or even possibly calling a nurse at the prescribing physician's office to ask direct questions. The next thing that we will be doing is sanitizing our work area and then washing our hands. Depending on the strength of disinfectant, gloves might be advisable. For disinfectant, you want to follow the directions on the label of the container, or use a 10% bleach solution. In that case, you want to apply, make sure that the surface is wet, and let it air dry. While this is air dry, I'm going to wash my hands. Now that my hands are clean, I'm going to proceed with the first medication, and I'm going to remember that we're going to be making sure we have the medication for the correct person, the correct medication, the right dose of the medication. We're going to be using the right route for the medication. Make sure it's the right time. It is currently 8:30 in the morning. We're going to do the right documentation following the medication. Remember, after we pass any medication, we're going to observe, report, and record the person's response to the medication in the HCC notes or the service notes or progress notes, depending on how your facility would like you to do that.